Hi, my name is Carla Andrade, and I am a mental health professional. I have a PhD in psychology, and I am a psychiatrist that focuses on treating people that struggle with depression, anxiety, eating disorders, post-traumatic stress disorders, attention deficit disorders, schizophrenia, neurosis, and people with bipolar disorders. I treat both childhood disorders and adult disorders. The majority of my patients are dealing with more than just one mental issue. But one thing that they all have in common is that they are all clinically depressed, with a slight increase in the number of adolescents being clinically depressed in the past 10 years. People with depression often feel like their existence is worthless, leading them to think that suicide is their only way out. Suicide is the 10th leading cause of death in the United States. Depression symptoms vary from insomnia to persistent sadness, empty feelings, feeling of hopeless, worthless, and helplessness. A general type of treatment for those who have suffered from depression is an effectual drug therapy along with antidepressants. It is important to also mention to patients that suffer from depression that even though medications can be helpful, a lifestyle change will also contribute to their recovery. This lifestyle change can include exercise, nutrition, social support, and getting an adequate amount of sleep. Someone who is dealing with depression should be on consistent medication for 6 to 1 year or until the patient no longer feels depressed. As a psychiatrist, I have dealt with many patients, but there was one particular adolescent that made me realize more than I already did the severity of depression and what occurs when more than one mental illness intermingles with another. A 17-year-old middle-class Caucasian female dealt with a post-traumatic disorder and anxiety, with so much pressure from her peers at school to be someone she was not, along with the constant bullying. This particular young girl was then diagnosed with depression. I recommended antidepressants, relaxation therapy sessions, and psychological interventions. Depression is the leading factor that causes people to commit suicide. It is important for parents and people to know the signs and symptoms for depression so people can seek help for their loved ones. As a mental health professional, and those working towards a mental health career, it is important to remember that sometimes it is hard for people to seek help and accept that, in fact, help is sometimes indeed needed. Many people that suffer from depression don't seek help because they feel ashamed to feel the way they do, or in many cases they feel like no one really cares. Therefore, reminding them that they are being heard and that the way they feel matters is extremely important.